So my name is Professor Rich Mitchell. I am Professor of Health and Environment at the University of Glasgow, and I lead the Places in Health programme at the Social and Public Health Sciences unit. So childhood is a time when our bodies and minds are developing, and the places that we grow up in can really affect the way our health and behaviour develops over time. So the air that we breathe, the things that we hear, the things that we witness and see, whether we feel scared or safe, and the habits we develop are all really important for building a healthy body. And we know that those exposures and those habits that happen in childhood have impacts well into adulthood. The Places in Health programme basically asks two kinds of questions. The first one is, where do children go? What do they do in their neighbourhoods? How do they behave there? And how does the environment that they're in impact their health? And then secondly, what happens when places change? So if we make a change to a neighbourhood, does the health of the children and the adults living there improve? And we're also interested in thinking about what kinds of changes we could make. So we imagine how neighbourhoods could be and then try to use our science to identify what the health impacts of that could be. The heart of the Places in Health programme is a great study called Spaces. And in this study, we work with children and we ask them to wear devices which tell us where they go and what they do. And that enables us to explore the impact of neighbourhood on their health and behaviour. So one of our key concerns when we think about places in health are the different ways in which different sorts of children from different kinds of backgrounds use their neighbourhood environment and the kinds of environments that they live in. And we know that these differences in their neighbourhoods are a big contributor to the health gaps that we see emerging through childhood between the most and least advantaged kids. The data sets and the studies that we're working on in the Places in Health programme will help us answer some of the burning questions we have about what point in childhood does our interaction with neighbourhoods start to become fixed? When do the impacts of our neighbourhoods on our health really start to emerge? And we're particularly interested in the extent to which what happens in childhood affects our health as adults and into old age.